Today we will be talking about mHealth. What is mHealth? The benefits of mHealth, and then I will also provide some examples, real life examples of mHealth. And then we will talk about telemedicine. What is telemedicine and the benefits of telemedicine, and also provide an example. And then a summary of the two types of technologies, and then we will discuss if one is better than the other. What is mHealth? mHealth is short for mobile health, which is essentially mobile self-care. It allows patients to gain access to their personal health information from their cell phone. It allows patients to access things such as labs, review doctor's visits. They can message the provider from their cell phone, tablet, or any other mobile device without the assistance of someone in the office. Meaning you don't have to call and wait on hold, leave a message, wait for the doctor to call back. It's all at your fingertips from your cell phone. The use of mobile phones for health information has increased. In 2011, there were 61 million users. In 2012, that increased to 75 million users just on mobile cell phones. Now, the use of tablets has doubled. In 2011, there were 15 million users, and in 2012, there were 29 million users. Needless to say, this is a growing technology that is being utilized, which is not surprising considering everyone has a cell phone or tablet or some kind of electronic device in their hands at all times. What are the benefits of mHealth? Well, first, it's convenient, quick, and easy. You don't have to call the doctor's office. You don't have to make a visit. Everything is at your fingertips. So therefore, the convenience factor of mHealth is above all else. Also, it's secure communication. Most mHealth apps or online databases allow you to communicate securely between you and your medical staff. Therefore, you can ask questions, make appointments, all through a secure network via mHealth. Also, you can be monitored using portable devices. For example, I had a friend who was having a heart condition, and he was put on a heart monitor. Well, that heart monitor was linked to his cell phone, and he could track what his heart rates were and things of that nature and submit that information to the doctor's office. So that kind of gives the ability to have quicker transmission times between the doctor and the patient regarding potential conditions. Also, it's decreased cost for patients and physicians. If you can just send your doctor or nurse an email via mHealth versus having to make an appointment, that saves you money. And it saves them money because they don't have to block out an appointment just for a quick question. So they can see real patients in that time. Here are some examples of mHealth. These are real life examples of things that I use on a regular basis. The first thing that I use is the Publix Pharmacy app. This right here is a picture of what the app would look like on an iPhone. And then these next three pictures here are just screenshots from the app itself on my profile. First is the home screen. Once I click on my name, you could have multiple users on your app. You can have yourself, a minor child, or a pet. So this is my main screen. Once I click on my name, it tells me if this prescription is eligible for refill, or if I need to request a new prescription from the provider. And if it does need a new prescription, I can just click this button here and it'll send a request to my doctor and automatically try and get a new prescription from the doctor if they authorize it. If I click on this little arrow, this screen will pop up. It gives more details about the prescription itself, like the prescription number, how many refills are remaining, the directions, when it was filled last, etc. So it allows you to keep up with your refill. So if you're running low and you might need to make a doctor's appointment, it will let you know from the screen. Also, the app gives you the option to create a reminder for your medications. So if you're one that forgets to take your medication, you can schedule a reminder every day for your prescriptions, and it will send you a notification when it's time to take your medicine. The next thing I use here is my patient portal at my doctor's office. It allows me to communicate with the office. I can schedule appointments. I can send the nurse an email. I can view lab results, view my plan of care, and other things of that nature. It's very convenient because this doctor's office has a little bit wonky business hours, and they're usually open very early in the morning and closed before I get off work. So this is an easier way to communicate with the office sometimes, and scheduling appointments on here is very easy as well. Next, we are going to talk about telemedicine. Telemedicine is two-way, real-time communication between a patient and a physician, kind of like Skype or FaceTime, if you will. The patient is typically at one location, while the provider is at a remote location where they can see multiple patients in different locations. Telemedicine gives the physician the ability to diagnose a patient without actually being physically present, and also provide treatment plans for the patient. So it is a clinical interaction between a patient and a provider. Telemedicine does require audio and video. That way the provider can see and hear the patient in order to adequately diagnose what the patient is suffering from. What are the benefits of telemedicine? Telemedicine can be done from either home or a local facility that is equipped with telemedicine equipment. This allows more privacy. Doing a consultation with a physician from home is more private than going into a specialty clinic where you can run into people you may know or just having prying eyes. Being at home makes you feel more comfortable. It provides access to healthcare to those who may not have transportation, or who may live a long way from a specialist office. So for example, if you live in rural America and the nearest city is 50 to 100 miles away, it may be easier to go to your local health department and speak to a doctor via telemedicine than it is to drive the 50 to 100 miles to go see that doctor. Also, some patients aren't physically capable of getting out of bed or traveling. So telemedicine is a way for those patients to be seen more frequently, because the doctor comes to them versus them going to the doctor. And this also is decreased costs. It's not taking up time in a healthcare facility. It's not, doctors can see more patients because there's less time in between, things of that nature. So the cost aspect of it, yes, technology can be expensive, but it may be cheaper than having a big building and only seeing a couple people a day versus using telemedicine and being able to see twice as many patients. Here are some examples of telemedicine. I don't personally use telemedicine, so I can't give you any personal examples like I did with mHealth. But in this picture here, it looks like the woman is chatting with a doctor at home about some symptoms. So you can see the physician on the screen, and they are talking from the privacy of their own home. On this picture here, it looks like a mom potentially has taken the child to the doctor, maybe with an ear infection. And you can see on this screen here, they can see the doctor, and then there's a picture here where the doctor can see what is going on with the child, as well as an image here of the inside of her ear. So that just proves how useful telemedicine can be. Sometimes you think, oh, well, the patient can't assess me. Well, they can. Technology has allowed this ear scope to be able to transmit to the doctor so he can see what is going on. And then this picture down here looks like telemedicine in a hospital setting. This patient may be in an ER or something like that, and the doctor has come to them remotely to help. Maybe there's no pediatric doctor in this particular hospital, so they have brought one via telemedicine to assess the patient. In closing, both of these technologies allow greater control for the patient. It gives them better access to care that they may not have normally had on a regular basis. I know that prior to using the patient portal and the Publix pharmacy app, I would just kind of refill my prescriptions when they were out, kind of just go to the doctor and ask questions when I was at the doctor, never in between. But now I kind of check up on things and review my lab results instead of waiting for them to call me if they called me. And this also leads to better health outcomes. When patients are monitoring their own health, their health tends to increase. So is one better than the other? No. It's just a matter of the needs of the patient. For me, mHealth is more beneficial than telemedicine. I have easier access to a doctor's office. I'm mobile and I can get there. So mHealth just allows me to check up on things better. Whereas my grandma, on the other hand, she's not very mobile. So telemedicine would be very helpful to her. If she could go to a local health department and use telemedicine to see the doctor, that would be more beneficial to her versus mHealth. Also, she's not very technologically sound, so using an app may not be the best for her. I hope you enjoyed my presentation. The next slide will be references if you would like to research this on your own. Thank you and have a great day.